In this module, we're going to talk about preparing to access the NDIS. We will work through the workbook, I Can Prepare to Access the NDIS, developed by Project Embark, which can be found on Embark's website. This section will also cover gathering evidence for an NDIS application, including some of the barriers and opportunities. We're going to start by discussing the workbook developed by Project Embark called I Can Prepare to Access the NDIS. We've used this workbook in the project's direct engagement activities and have found it extremely useful when engaging with consumers. It helps to facilitate a discussion about the NDIS and psychosocial disability and understand whether a person is ready to access the NDIS. It then works to generate an understanding of how a person is impacted by their disability day to day, determine how the NDIS might be able to support a person, and start to understand what those supports might look like. And finally, to assist in getting ready for the NDIS by identifying goals and gathering evidence. This workbook is not intended to be submitted with an NDIS application, but can help with getting ready for the process. In this section, we're going to talk you through parts of the workbook and provide some examples to give an idea of how it can be used when supporting someone to get ready to make an NDIS application. If it helps, you can follow along with your own copy of the workbook, which you can download from Project Embark's website. The first few pages of the workbook explain how it can be used and get a person to check their eligibility. We're going to look at page 4 of the workbook, which gets a person to look at their mental health. This can either be completed by the person wanting to access the NDIS themselves or by someone supporting them while discussing the questions. This is where you would ask the person you're supporting to look at how their mental health condition impacts them in their day-to-day. In the first box, you can record their diagnosis, if they have one, and their symptoms. In the second box, discuss how a person's mental health condition affects them long-term. This is helpful in evidencing that a person's disability is lifelong or likely to be lifelong. The following page asks about a person's treatment. An application for the NDIS needs to prove that a person's disability is likely to be lifelong. This section helps to identify that treatments have been tried and assists with starting to evidence that further treatment is unlikely to resolve the condition. In the table on page 6, discuss how the person's condition impacts them in their day-to-day life. Use the 6 areas of functional capacity outlined in the table to determine in what areas a person experiences difficulty. As an example, you could record how the symptoms discussed previously prevent a person from making or keeping friends or relationships, which would go under social interaction, or how their symptoms prevent them from managing their medication, which would go under self-care. This helps to start identifying a person's disability, and therefore starts to translate the mental health condition into the language used by the NDIA. On page 7, we start to talk about a person's goals. Note that setting goals comes later in the NDIS process, but we find it helpful to discuss them early on. Discussing goals early on with someone thinking about applying for the NDIS can be useful to identify how the NDIS could be relevant to them. Talking about goals is also a good way to somewhat counteract the deficit-based nature of the NDIS and have a more positive discussion. On page 8, we find it useful to talk to the person we're supporting about who is in their support network. This can help to identify people who could assist with an NDIS application, such as by writing supporting letters or going to doctor's appointments.
Now we're going to take a look at some of the barriers that Project Embark identified that exist when gathering the supporting evidence needed for an NDIS application. The costs involved for assessments or obtaining medical documentation can be very unaffordable for people who are experiencing or at risk of homelessness. Obtaining medical documents can cost from anywhere from $30 to $60 from clinicians, and can be over $1,000 for certain functional assessments. A lack of services and long wait lists prevent people from being able to see medical professionals to get the documentation they need for an application. In some regional areas we visited, it can be up to a 3-month wait to see a GP. Low levels of engagement with medical practitioners and the transient nature of this group mean people experiencing homelessness often don't have a medical practitioner they're familiar with. This is particularly problematic as GPs may be reluctant or unable to provide the information needed for an NDIS application to new patients. Furthermore, having no formal diagnosis can make it difficult to obtain documentation. Many service providers lack the capacity to support people to gather the evidence they need. And this can be due to a lack of time or lack of understanding on how to navigate the NDIS. As we discussed earlier, it's difficult for people experiencing homelessness and psychosocial disability to access the NDIS without support from greeting to meeting.
Some of the opportunities we've identified to address the barriers in gathering evidence include gathering evidence on behalf of the person applying for the NDIS or supporting them to gather their supporting evidence. If the person consents, this could involve getting their medical reports sent to you so that they're all in one place. Providing the person you're supporting with a USB stick to store their documentation in one place is a good way to ensure that everything is together and allows them to have control over their own medical records. Start gathering supporting documentation before completing the access request form. The medical practitioner who completes Part F of the access request form can then refer to these documents. And ensure that all evidence is consistent as well as being objective and relevant. More is not necessarily better.